Hi everyone, it's Dr. Hart again. Remember we've been talking about atrial fibrillation, one of the most common irregular heart rhythms that we deal with in our population. Well, we're going to continue today diving deeper in the management of that condition. Remember, atrial fibrillation by itself is not a life-threatening rhythm or immediately life-threatening rhythm. And the reason for that is because the problem is on the top chamber of the heart that goes fibrillating or quivering like that and causes, a disruption on the heart functionality, but not to the extent to be immediately life-threatening. Well, there are three main priorities in the treatment of this condition. Number one is relieve patient symptoms. Many patients that have atrial fibrillation feel like their heart is going to jump out of their chest, and they may feel lightheaded, dizzy, short of breath. They may have chest pain. They may even pass out. So obviously for someone that feels that way, our first priority as cardiologists is to relieve those symptoms. The second priority is to protect them against the major potential complication of atrial fibrillation, which is strokes. And last but not least, we would like to either restore the rhythm of the heart or at a minimum control the heart rate so that it's not too fast, not too slow either, because both of them could be problematic. So the first option of treatment that we usually offer for patients that are still in the hospital but have failed the initial medications that we use to control the rhythm or control the heart rate is something called cardioversion. And this is a short procedure that is done under heavy sedation so that the patient is completely comfortable through it, sleeping through it, and not feeling any of this. But what we essentially do is, one, we make sure that no blood clots have formed inside the heart to begin with, especially if the patient has not been taking blood thinners. If the patient has been on blood thinners for a long time already, that step may not be necessary. But as a general precaution, we do that first, make sure there is no blood clots. And then if there is none, go ahead and shock the heart, reset the heart back into rhythm. You probably have seen some scenes like that in the movies when patients get paddled out of an irregular heartbeat. And when you frequently see that on the movies, that's to treat a totally different type of rhythm abnormality called ventricular fibrillation or ventricular tachycardia. But the principle is the same. Do an electrical reset of the rhythm, restoring the normal rhythm. As we reviewed previously, that normal rhythm, we call it sinus rhythm. So that will be option number one. Many patients will cardiovert on themselves, meaning their own body could do that, or their initial medications could do that. Therefore, that shocking of the heart procedure is not necessary, and they could be sent home either on normal rhythm or maybe even still on atrial fibrillation, but with a controlled heart rate, not too fast, not too slow. Now, that's for the acute treatment. For the long-term treatment, there are a couple of more elaborate options that we haven't discussed. Remember, the priority number two is to reduce the incidence of a stroke or the risk of a stroke. Well, there are nowadays devices that could be implanted in the heart known as left atrial appendage occluders. The upper left chamber of the heart has a little crevice there in the upper part called the left atrial appendage. It's a little corner of that upper left chamber where about 90% of the blood clots form. We have the technology to access that site using a catheter that comes through the blood vessels that run in the groin, reach that little space there, and put a lid on it. And that lid will isolate that area of the heart and will not allow any blood clots that form in that area to go to the brain and cause a stroke. The advantage of that procedure is that therefore the blood thinners are no longer as necessary. Patients may need to stay on the blood thinners there for a few weeks to months after that implant, but once the implant is in, then we don't have to worry long term about using blood thinners. The disadvantage of it is that obviously it's an invasive procedure. It's not as invasive as a major surgery, as an open heart surgery. Remember, this is done through a catheter, so it is a lot less invasive and the recovery is much faster, but still is an invasive procedure that carries certain degree of risk and discomfort, etc. But it's a good option for those that have a lot of problems with blood thinners, like bleeding that is recurrent, that requires transfusions, admissions to the hospital, etc. So that's as far as the left atrial appendage occluders. And last but not least, there is also the option to control control the rhythm using a procedure known as ablation, a minimally invasive procedure where the electrophysiologist, meaning the electrician of the heart, so to speak, gets into the patient's body, again using those blood vessels in the groin area to gain access to the heart with electrical instruments and map out all the electricity around the left atrium, find out where the short circuits are, and zap them, cauterize them, creating that way some very small amounts of scar tissue that will interrupt that loop, will not allow that loop to go on and on and on and on and on, perpetuating the atrial fibrillation or the atrial arrhythmia. And this procedure is more effective than most medications available in the market and has the potential to cure the patient from atrial fibrillation, or at least provide the patient with a long-term solution so that the patients are not so dependent on antiarrhythmic medications. Here you have them, advanced therapies for atrial fibrillation, a little bit more invasive, a little bit more involved, but still very good options for the treatment of certain patients with atrial fibrillation. Discuss it with your healthcare provider, discuss it with your cardiologist, talk to them, see if you'll be a good candidate for any of these advanced therapies. And remember, be smart to take care of the heart.